Up next to introduce our next finalist here. He's a blogger for PC Magazine. He was the editor-in-chief for 15 years at PC Magazine. In his day job, he serves as chief information officer for a financial firm. Michael J. Miller, head on up. Hi, Michael. It's great to see you.
See you.
Thank you.
Well, I'm a little skeptical when it comes to gadgets because I've seen a lot of them. 20 years ago, Robin came to me and said, I think I want to do this little event here at CES called Last Gadget Standing, and I've been judging this ever since, and I've seen a lot of things. So when I heard about this next product, well, I was a little skeptical. I mean, you get something, this size, and you put it against your face, and it gets rid of your sinus headaches. Well, I get sinus headaches, but it didn't seem a little nuts to me. So, okay. And then I saw the scientific studies they had and said, okay. Then I got one, and I took it home, and it worked. And not only did it work on my sinus headaches, it worked on my wife's sinus headaches, which was even more impressive. So I was a skeptic, but now I'm a believer. And here to tell you about it is Jennifer Ernst and Dr. Shu Das.
Shubhanoy Das. Thank you, Michael. Now, I got to ask you, but by the way, I'm Jennifer, he's Shu, if you figured that out. I got to ask you, we're here in Las Vegas, and am I the only one that nose, sinuses, head is getting completely jacked up by the smoke in the casinos and everything else? And it's even worse for probably about 1 in 5 of you that have allergies on a regular basis. So we have developed a completely new way to treat the sinus pain associated with allergic rhinitis. It's a non-pharmaceutical solution that uses a slight bit of microcurrent applied to the skin around the sinus passages. FDA cleared. It is an FDA Class 2 medical device under a 510(k) clearance. We are in the market today. So this is shipping. No prescriptions required. It has been shown in our clinical studies to be as effective as the leading pharmaceutical products, actually even better than most, 4 times as good as Sudafed. So, Shu, when you first saw this, you were a little scared. Oh, he was supposed to run a demo. Sorry, let's go ahead and do that. So to use ClearUP, you actually just apply the tip of the device to your skin. You glide it along the cheekbone. It vibrates to tell you it's located at a treatment point, which is associated with the nerve and blood vessels that innervate the sinus passages. Once it finishes vibrating, you glide it to the next treatment point. So the device itself is helping guide you to the right treatment points that will give you the maximum benefit. This tiny microcurrent is a proprietary stimulation technology. With a 5-minute treatment, 74% of people saw clinically meaningful benefit after 10 minutes of use. We ran a 4-week study in which people saw 40% reduction in use, and the people that were using it twice a day saw about 70% reduction in pain. So I was about to say, you were a little bit skeptical.
Yes, at first I wasn't sure this was going to work, and we went to Jennifer and kind of told her the things that we would need to see it to happen.
Yeah, he challenged me to come up with a double-blind, randomized clinical trial at a leading Tier 1 sinus center. And that is exactly what we did. The FDA was happy. And you have seen some of the results with your patients.
Yeah, just last week, I had a patient who was a farmer from Ohio who, unfortunately, despite multiple surgeries and several rounds of medications for the last 2 years, has been unable to go outside, has been debilitated by headaches. Since he's tried this device, he's been able to start playing golf again. He's been able to spend time with his grandchildren. It's been revolutionary for him to be able to go outside and return to his normal life. And so I'm really proud of and excited about ClearUP and the new opportunities it gives us to treat patients with severe headaches.
Okay, so this treatment is part of a new field of medicine called bioelectronic, dry electronic medicine. Our team is committed to bringing solutions out of this field into the mainstream. We are exhibiting at Eureka Park, so come down, see a demo, talk with Dr. Doss. And I'd like to ask you that there are millions of people outside this room who also can benefit from this treatment. So Last Gadget Standing is not merely a contest, it is also a platform for reaching the world and for reaching the millions of people like the farmers, like the firefighters, like the tech engineers that you work next to and the programmers who suffer on a daily basis. Can they count on you to make ClearUP the last gadget standing?
Hey, before you head off, I just have one quick question. So this does not dispense medication.
Correct.
It's waves.
It's electrical waveforms. There's no medication whatsoever, and therefore no chemical side effects, no drug interactions.
The big concern that most people have when you put medical devices in the palms of consumers' hands is that they'll use that maybe the wrong way, won't seek medical attention when they need it. As a physician, as a doctor who treats this all the time, how safe is this really?
That's a great question. We've had to.
Oh, sorry.
We've had to go through an FDA usability study to show that this would be safe for children, for adults, and they allowed us to sell it over the counter after we passed all those tests because it uses a very safe microcurrent and not a major current like a TENS unit or something that provides a lot more electricity.
A major factor in that study is that we scored a 4.9 out of 5 in usability, which means that people reliably use it correctly.
I don't know if you guys can hear me. My voice doesn't usually sound like I've been smoking all night. I'm not a smoker. See me after. Man, we're only on number 2. Thank you so much.
Thank you very much.